Well, at least 5 states in the United States, including New York, have confirmed cases of the Omicron variant, with President Joe Biden announcing a new action plan to battle COVID-19 during the American winter. He also announced new travel protocols for inbound travelers to the U.S. For more, let's go to New York and speak to our correspondent there, Sherwin Bryce-Pease. So, Sherwin, interesting, as we mentioned, the announcement of a winter COVID plan. Share with us some of those details, particularly with the news that several states have now confirmed the Omicron variant in their territories, including where you are in New York.
Well, I don't want to shock you, Tsepiso, but the winter plan doesn't look too different from the summer plan, right? The core of the Biden administration's approach here is vaccines, vaccines, vaccines. They've announced an educational program to get 100 million American adults boosted. So that's essentially after the J&J shot, within 2 months to get a booster from the one shot, or if it's an mRNA vaccine, after the 2 shots, within 6 months of that second shot now to get a booster. So the new protocol is essentially, in terms of the mRNA vaccine, it will be 3 shots. They also have extended mask mandates on public transit. They are requiring private healthcare, Tsepiso, to fully fund the costs of home COVID-19 tests. And of course, the president also announcing new protocols in terms of incoming travel to the United States. He addressed this late last night. This was him.
It used to be that international traveler flying to the United States had to test negatively 3 days before their departure from that country. Well, I'm announcing today that all inbound international travelers must test within 1 day of departure, regardless of their vaccination status or nationality. This tighter testing timetable provides an added degree of protection as scientists continue to study the Omicron variant.
And of course, Tsepiso, no word from the administration as to when they will review the travel ban that was instituted since Monday on 8 Southern African countries. The president earlier this week talking about how they will be reviewing this on a day-to-day, week-to-week basis. But let me give you some numbers. In just the last 3 days, November 29th, 1,630 Americans died, well, certainly people in this country, from COVID-19. November 30th, 1,588. December 1st, 1,546. Almost 5,000 deaths in the United States. They're averaging over 109,000 cases per day. A huge concern here that things could, of course, now spiral out of control, but particularly now in light of the Omicron variant, Tsepiso.
So the significance of New York shown, obviously it was once the epicenter of the COVID-19 pandemic itself, confirming at least 5 cases now of Omicron. Many of the cases in the U.S. linked directly to travel from Southern Africa. Is that right?
You're absolutely right. Yes, at least one of the 5 cases in the New York district, my understanding, is the Long Island case, which is part of the New York City metropolitan, just outside of Manhattan. A 67-year-old woman recently returned from South Africa. We're seeing similar indications from cases in California. We understand in Minnesota, direct relationship in terms of travel to the Southern Africa region. Governor Kathy Hochul addressed these 5 cases in New York. Of course, as you correctly point out, Tsepiso, once the epicenter of the global pandemic. This was Kathy Hochul. Watch.
This is an individual who traveled from South Africa, who tested negative upon returning to the U.S. on 11/25, and on November 30th, they took a point-of-care test, and they did test positive. And Northwell sent the results sent the individual to a lab, and that person did test positive. Again, a traveler from South Africa who arrived here and is a Suffolk County resident, a 67-year-old woman. Our second case is a Queens-based. The vaccination status is unknown to know whether or not this person had been vaccinated or not. Third case, similar situation, no other further personal details, but the vaccination status is unknown, Queens-based. And another case is from Brooklyn, unknown vaccination status, and we just received word of another suspected traveler case here in the city that was identified in the city, and what's in one of the 5 boroughs. So we knew this was coming, Mayor. We talked about this.
And a very offensive posture from the state of New York, Tsepiso, declaring last weekend a state of emergency, essentially to shore up capacity in hospitals, to defer non-priority surgeries, because they are expecting numbers here to climb. And of course, their experience last year and the devastation that COVID-19, in terms of its impact in this region, really educating them in terms of how they need to prepare for what they believe is coming, particularly in light of the winter months here in the United States, Tsepiso.
Sherwin, you and I spoke about the tough role President Joe Biden has in doing a diplomatic balancing act, so to speak. So he's unequivocal now about the fact that there is going to be no new lockdown in the United States. That's despite the presence of the variant there, but he's at the same time also defending the US's role in helping to alleviate vaccine inequity globally. What exactly is he saying?
Yeah, it's really, really complicated because, domestic politics is essentially local. And so his priority is to protect the American population first. But as you've seen, there's been a widespread multilateral criticism directed at the United States and many other countries for imposing these travel bans on a region that can ill afford this in terms of its economic trajectory, given that we are almost 2 years now into this pandemic. But he defended himself at the White House earlier today, saying the United States has done more than any other country in terms of donating vaccines around the world. But he's also talked about South Africa particularly, and the difficulties that South Africa, like the United States, are going to face in terms of reaching that ceiling, in terms of the number of people you're going to vaccinate, and then having to deal with those people that are absolutely determined not to get vaccinated. This is what he said earlier today. Watch.
I get criticized for not doing more for the world. We've done more for the world in providing vaccines available and help than any nation, every other nation in the world combined. In addition to that, we've also, with regard to India and other countries, and we're working around the clock. Remember, I suggested we suspend the patents, let everybody be able to have access to this so they can make the vaccine in their own countries. And thirdly, in Southern Africa, for example, South Africa has all the vaccines they need. They don't want any more vaccines now. One of the things I'm considering is how can we help them deal with the issue of, as I said to you before, when the biggest challenge we had in the beginning of this administration, in my view, was not getting the vaccines produced, although that was not easy. And I've got to give, President Trump early on went out and got them to do the research to try to get the right vaccines. But logistically, getting the vaccine from a container that gets delivered to you, to a hospital, to a state, and getting it in someone's arms, that's a very, very difficult thing.
And as these conversations around vaccine mandates gain momentum in South Africa and around the world, let me tell you what just happened this week here in the United States. Tsepiso, a federal judge blocked a Biden rule establishing a national vaccine mandate for healthcare workers. The judge said this: "There's no question that mandating vaccines for 10.3 million healthcare workers is something that should be done by Congress and not by a government agency." Quoting the judge here, "It is not clear that even an act of Congress mandating vaccines would be constitutional." So one expects that this finally will be decided by the Supreme Court as it works its way through the lower courts up to the High Court. And one imagines that something similar might be developing in South Africa where you are, Tsepiso.